one of the things that I'm very interested in, and it's a kind of theme of mine, is how are medical data presented to the public, and even the concept of how are, because most people think data should be pronounced is, but actually data are plural, but it always sounds weird saying are, however. But it's a very, the world of presentation of data is extremely misleading. So for instance, in my particular pet topic, we talk about statins, for instance, and then we always hear that, I think the one that comes to mind was the heart protection study, where they said if 10 million people took this statin, 50,000 lives a year would be saved. And I just go, at that moment, you go, hold on, you can't save a life. I know this sounds rather depressing to say, but you can't save a life. Unless you're going to make people immortal, at some point people are going to die. So the only interesting thing from a medical point of view is, well, there are many interesting things, but perhaps the most interesting thing is, for how much longer would you live? Now, what's fascinating is that in cancer studies, they talk about increase in median survival. And again, of course, no one knows what median means, and it's kind of irrelevant, but we'll use the word average instead of median. So if you took this anti-cancer treatment for a year, on average, how much longer could you expect to live? Now, let's say it's 6 months. Now, you may think that's good, or you may think it's bad, or you may not have any particular view on it. But at least in cancer studies, they tell you, if you take this for a year, or 2 years, or whatever, however long it is, you'll live an extra 3 months, 6 months, 12 months, on average. Now, of course, not everyone's going to be average. Some people will get no benefit. Some people might actually, the cancer goes and never comes back again. Because you can't carry the trial on forever, so you'll never really know how long it will take. I mean, you can if it's rapidly fatal, then you say, oh, everyone was dead after 2 years. So you can say, well, we know exactly how much you get an increase. But interestingly, when you talk about heart disease or anything to do with cardiovascular medicine, they never present that data. They never say, how much longer do you think you'd live? So I often ask the question to people, using the most positive studies, and the two most positive studies are the heart protection study and 4S, which is Scandinavian simvastatin something study. And those studies lasted for 5 years. Both of them lasted for 5 years, and both of them came out with results saying something like a 35 or 40% reduction in cardiovascular mortality. Now that sounds quite impressive. Well, it's almost a half. Oh my God, I've taken this. It's protecting me, it's saving my life. That's what most people think. When I speak to people, most doctors think this. So I ask them another question. I say, right, if you took the statin for 5 years, all right, you took it for 5 years, using the data from those studies, how much longer on average do you think you would live? And I ask doctors this and they go, 5 years, 4 years, 3 years. I mean, they're talking years. And I ask patients this and this, sometimes in the surgery when we're chatting about things, and I ask people down the pub. Yes, I'm very boring, but and they all come out with years, or 10 years, or 15 years, or whatever they come out with. It's fascinating, because when I tell them that actually I have worked with the Medical Research Council and someone who is a specialist in survival data, and when you plot it out, what you find is that if you took a statin for 5 years, using the data from these studies, the most positive studies that there are, the average increase in survival time is 2 weeks. So, on one hand, you present the data saying 35 to 40% reduction in mortality rate. That sounds hugely impressive. Present it in another way, you might live 2 weeks long. On average, you might not get any benefit at all. In fact, it's most likely you will get no benefit at all, because the benefit is only for a very small percentage of people. Even for those very small percentage of people that do get a benefit, the increase in life expectancy for them is around about 4 months. All right, so it's those few people's 4 months that actually create an average 14 days. So what you can represent it and say, actually, according to these data, you take a statin for 5 years, all right, and there is a 2% chance that you might gain some benefit. So 49 out of 50 people will get no benefit at all, none, zero. The 2% that do get a benefit will live on average for about 4 months longer. So if you take the 49 and add them to the 49 people who get no benefit and add the one person who gets a benefit together, you get to that 14 days effectively. So it's a minute benefit, you don't even know if you're going to get it. So, they present the data to sound as positive as possible, split it down, take it out, look at it again. What does it mean? And I think in many ways the manipulation of the way the data is presented is one of the greatest problems that I can see. I just wish all data could be presented in the same way. How much longer? What improvement or damage to your quality of life during that period of time? Because that's usually important. Because say for those 14 days, over 5 years, you'd spend 14 days going to the pharmacy, picking it up, taking the tablets, going to your doctor. In fact, taking that out of your life, it'll probably take a month to do all that over 5 years, and you get 14 days. What's the equation? So I really wish that people would present data in the same way from all the studies, so it's absolutely comparable.